The following program is an original production of WICC PBS Chicago.
This week on In the Loop. Could it soon be the end of the Affordable Care Act? Premium costs are soaring, and the Trump administration is calling for a repeal. But what does that mean for the millions of Americans who depend on it for health insurance?
The idea of taking that coverage away without a replacement product is nightmarish to me, and I think it's immoral.
The city dished out some cold news to food truck owners in Chicago this week. They lost a 4-year battle to loosen regulations. What does that mean now for the small business owners?
We were basically running like a small restaurant, and restaurants are open like from morning till night, and we're only allowed to be open for 2 hours in a certain spot, and I don't think that's fair.
And a Chicago artist uses bullet casings and a 400-pound sculpture of a gun to showcase the violence driving families from their homes.
I decided that death by gunfire, intra-group violence, gun violence, was something that I wanted to focus on, and I needed to make an object that reflected that.
Stay with us for these stories and more tonight on In the Loop. Good evening, everyone. I'm Lauren Cohn. Nearly 500,000 Illinois residents depend on the Affordable Care Act, also known as Obamacare, for their health insurance. Republicans in Congress want to repeal and replace the law that also covers nearly 20 million Americans. After campaigning against Obamacare, President-elect Trump now says he wants to keep parts of it. Meanwhile, since many insurance companies have dropped out of the marketplace, premiums are soaring and the network of doctors is shrinking. As Chris Bury reports, the health care of thousands in Illinois now hangs in the balance.
Joanna Castro and her husband played by the rules, worked hard all their lives, and were rewarded by being able to retire early and spend time with their children and grandchildren. They had always received health insurance through their employers, so when they retired, they logged on to healthcare.gov to check out their options. As someone who worked in the healthcare industry, Joanna was a supporter of the Affordable Care Act's ability to provide insurance for society's most vulnerable.
I was excited because in my healthcare career, I had seen a lot of people who didn't have healthcare. And so because they didn't have healthcare, as they aged, they got sicker and sicker.
They did their research and picked a plan with a premium of more than $1,500 a month. That worked for them, particularly as Joanna has a pre-existing condition. Then in the fall of this year, they received a letter that their provider was no longer carrying their plan. They found a replacement, but it raised their costs dramatically.
Our deductible has gone up. Our premiums went up $400 a month. Our out-of-pocket limit has elevated. But the biggest part is our network, our provider network shrunk like you cannot believe. I mean, we are geographically bounded to local hospitals and local physicians. It's not even that I don't have the one of my choice. I have none.
They're not alone. In 2016, major providers such as United Healthcare and Aetna have pulled out of the Illinois market, while smaller providers such as Land of Lincoln have gone belly up, leaving residents with fewer options and higher premiums.
They're going up 44 to 55% on average for the lowest priced plans in each tier, and that's for next year. And that is going to be for everyone buying insurance on the exchange in Illinois.
The reasons are complex, but the bottom line is insurers were losing money.
The insurance companies were expecting more healthy people, more younger people to sign up to help offset the costs of paying for the sicker older people, and that hasn't happened to the degree that they were expecting. Also, they were supposed to get a certain amount of money from the federal government to help with these first few years of the exchange, and they haven't gotten as much money from the federal government as they were expecting either.
Some experts say that the higher rates in 2017 will compensate for the low pricing and higher claims in 2016 and thereby right the ship. But that does not acknowledge the elephant in the room, the election of Donald Trump. During his campaign, Trump was unambiguous on his plans for the Affordable Care Act.
That begins with immediately repealing and replacing the disaster known as Obamacare.
Since Trump's election, he has modified his stance, indicating he'd like to keep two of the most popular provisions of the health law.
When you replace it, are you going to make sure that people with pre-conditions are still covered?
Yes, because it happens to be one of the strongest assets.
You're going to keep that?
Also, with the children living with their parents for an extended period,
you're going to keep
very
that?
much try and keep that.
There are big questions out there right now about how that's feasible if you take away the requirement that everyone has insurance, because the fear is if that requirement isn't there, then all the healthy people are going to leave the market and the insurers are just not going to be able to sustain business paying only for sick people and not having any healthy people paying into the system.
That has healthcare providers deeply worried. Hospitals have the most to lose. For big city hospitals such as Stroger here in Cook County, the Affordable Care Act has made a huge difference. Before the law, most of the patients here had no medical insurance, so they relied on the emergency room for their health care. But with the expansion of Medicaid under the Affordable Care Act, 2 out of 3 patients here now have health insurance. Dr. Jay Shannon is CEO of the Cook County Health and Hospital Systems. President-elect Trump and the Republican Congress are now saying they are going to repeal the ACA and replace it. What keeps you up at night?
Well, I think the biggest thing is the idea of taking individuals who've had an opportunity now, maybe for the first time in years, they've got insurance coverage. It gives them not only access to care, it gives those individuals some peace of mind, it gives them some hope for the future. So the idea of taking that coverage away without a replacement product is nightmarish to me, and I think it's, frankly, I think it's immoral. The patients are going to have a hard time with it. Hospitals and health systems are going to have a hard time with it, and doctors are going to have a hard time with it unless there is an adequate replacement plan.
Going back before the Affordable Care Act, is it fair to say Cook County hospitals were losing millions of dollars a year?
Yeah, absolutely.
And since the Affordable Care Act?
Well, it's shocking. We're just closing our 3rd fiscal year where we have broken even.
As for Joanna Castro, she's nervous for the future, but she knows what her preference would be.
When I hear repeal and replace, I'm thinking that it's going to be a major tweak and work on it together and try to come up with something that works for people.
Cook County Hospital isn't alone in its call for measured changes in the Affordable Care Act. The 2 main trade groups for U.S. hospitals urge the president-elect and Congress to preserve health coverage gains and warn that repealing the act completely could cost hospitals $165 billion by the middle of the next decade and result in a public health care crisis. Joining us now to discuss the future of the Affordable Care Act and all of tonight's topics are attorney John Gioccaris, author and attorney Charmaine Cruz, and Shelby Livingston, reporter for Modern Healthcare Magazine. Welcome to all of you.
Thank you.
Thanks for having us. Obviously, difficult topic, very contentious. John, let me start with you. What should the future of healthcare then look like?
Well, Speaker Ryan and the Republican Congress have signified that while they are going to repeal the Affordable Care Act on day one, the emerging plan seems to be a repeal and delay. So that the 20 million Americans who have gained insurance coverage, most of them through Medicaid, will not be completely turned off immediately, and there will be a transition period. But at the same time, President-elect Trump does have to deliver on his promise, and this is something that Republicans have been campaigning on for a while. I mean, let's not forget, Trump was saying Obamacare is a total disaster. It's got to go. It's killing our wallets. It's killing jobs.
It's a close impersonation. But Charmaine, do you agree with that? Do you agree that that may be the right direction and that Trump is headed in the right direction, or is he off base?
Well, you'll be hard-pressed to find me agreeing with anything that the presumptive president-elect would claim. There certainly are issues and difficulties with the Affordable Care Act. That, I think, is agreed on by everyone who are discussing it. But even the Republicans agree, if you're going to repeal the act, then you need something to replace it with. Otherwise, as you mentioned, we're going to have this healthcare crisis and all these booming costs to the hospitals, 20 million uninsured. But it's not just that. It's also a lot of the other things that came along with the act. Women and men should be charged the same thing for insurance. The disabled should be covered. Pre-existing conditions should not be something that disable you from coverage. These are all something that were included in the act. You know, as John said, it's now become repeal and delay. The delay could be as much as 4 years, taking us into the next presidential term. And in the meantime, we're going to be living in what the New York Times has termed zombie land. You know, the act is dead, but kind of still alive. And so what you're going to see within that time period is a lot of the insurers, even more than we've seen thus far, leaving the marketplace. And that's going to generate tremendous problems and difficulties and a health crisis in and of itself.
Shelby, is it hard to feel sorry for the insurers when they say they're leaving the marketplace and they've lost money when there were caveats in the Affordable Care Act that protected the insurers as well? And remember also that the subsidies that people who enrolled, these 20 million people who may have enrolled, are coming from taxpayer dollars.
So some of the safety nets that were put in the Affordable Care Act to protect insurers, they actually aren't working as they were intended to. In particular, there's one safety net called the risk corridor, and that transfers funds from health plans that are doing well, that are healthy, and it gives those funds to health plans that got sicker than average enrollees. And it's not working because Congress has passed a few provisions that make the law budget neutral. So the Centers for Medicare and Medicaid Services can only give out what it takes in. So right now they're on the hook for about $8 billion in risk corridor payments. They're supposed to help those insurers offset losses.
But do you think the insurers then are gaming sort of the system? Because we're seeing whether you are in this subsidy program or whether you're an individual who went into the insurance, everybody's costs are going up. And even people with group insurance plans and even people in the business community who had to enact plans, overall everybody's costs are going up. So John, I'll go back to you. Do we get out of the business of government being involved in healthcare and we do free market?
Absolutely. I think well, first of all, the critical concept behind the plan that's emerging to replace it is having insurance companies compete for our business. One thing I've never understood is you can buy insurance plans in life insurance and car insurance and any other type of insurance across state borders. That's not the case for healthcare insurance. I think tort reform would go a long way to controlling costs as well. But the bottom line is, obviously the Affordable Care Act wasn't working. Young, healthy people weren't signing up despite the individual mandate. Despite the promise that premiums would go down per family by $2,500, they've obviously skyrocketed. And there were, the people spoke in this election, and I think they're ready for an alternative plan.
But look, I mean, the reality is that if you've got tens of millions of people who are uninsured and who can't afford insurance and who need insurance, I mean, these include children, the elderly, the disabled, then other people will have to pay for it in one way or another. I mean, there's no way to mix that up. So I think at some point as a society, you just need to decide, are we going to be the kind of society who are going to leave tens of millions of people, including children, elderly, disabled people, uninsured when they get sick or not?
So as a taxpayer, you're okay with that, subsidizing other people and their health care?
We subsidize roads. We're subsidizing these hospitals that pay for the emergency care services.
Well, isn't that what Medicaid is for, though? I mean, again, I think what doesn't get enough attention is that most of the people who have gained insurance through this healthcare law has been through Medicaid.
I think that's exactly right. About actually 10 million of them
Indeed.
have been through the Medicaid expansions that came as a result of Obamacare, which was one of the key things that Republican lawmakers wanted to gut. Every time they passed a bill gutting the act was the Medicaid expansions.
So Shelby, you've covered this a lot though, so do you think that maybe some of the things that the Trump camp is talking about, things like health savings plans, or we won't give you a penalty if you don't sign up, but maybe tax incentives or deductions, on premiums?
The thing about a health savings account is you have to have money to put in it first. If you expand health savings accounts, I mean, all of these low-income people that may be affected by a repeal because their Medicaid expansion is rolled back, I mean, they don't have money to put in the HSA to begin with. I would say that going to a private market, repealing and replacing the Affordable Care Act, we have spent so long with the Affordable Care Act now, trying to make it work, making progress, and it has made progress. We have the uninsured rate in single digits. Like Charmaine said, we've expanded preventive services. There's a ban now on insurers denying people coverage because they once had a cancer diagnosis or another serious illness. If we were to repeal it now, it's like starting at ground zero again. We go back to the start and we start all over. And all of the progress that we have made toward paying for value in healthcare versus just paying a fee for a service, it might get rolled back, and it's just a lot of lost work.
I have to bring it back to the dollars and cents. As someone who's personally been through this, lost group insurance, had to go through the individual. A lot of the companies dropped out of Illinois, so there's very few options currently on our marketplace here in Illinois. Most of them are HMOs. There's one Blue Cross Blue Shield PPO. But when you look at the pricing of that, you see that the premiums are very high, and if you add on to that then maybe what you might pay if you're a healthy person just going for annuals, and then if you have some medications, it becomes, John, like a mortgage payment.
Indeed. And that's why, what can't be denied is the effect that the Affordable Care Act has also played on jobs. You know, there are these new nicknames that have developed called 49ers and 29ers. The 49ers are the businesses that are intentionally keeping their payroll below 50 people just so they don't have to comply with it. And then there are the 29ers who, people who are working part-time are stuck at 29 hours a week, again, just to dodge the mandate. Theoretically, once these obstructions are removed, then businesses can expand and create these jobs, and jobs obviously is what creates income and what will allow these people to be able to put money in health savings accounts and ideally have insurance companies compete for our business and create more plans, such as here in Illinois as well.
Well, I'm glad you brought up jobs, because another job buster perhaps could be the fact that the food trucks just lost in this 4-year battle to loosen restrictions. So now 2 of the important points that came out of that is that they still have to remain 200 feet away from restaurants. Charmaine, fair to the food truck or fair to the restaurants?
Well, you know, I don't love this ordinance. It clearly is anti-competitive. Is it unconstitutional? You know, I mean, I think people who don't like this ordinance should really get on the phone and call their lawmakers and call their aldermen in particular. My biggest sorrow in this whole thing is the cupcake truck that's parked outside my building will no longer be there, and I don't know who wouldn't want a cupcake truck outside their building at all times. But, you know, unfortunately with this ordinance, the damage is already done. Hundreds of food trucks that are the smaller businesses that aren't just food trucks that belong to more established restaurants that are already in a position to be profitable have already gone out of business. And so we do need to get on the phone if we don't like this and urge our lawmakers to make some changes and try to bring it back to Chicago.
Shelby, did the judge have a point, though, that it, you know, maybe creates more congestion and we need to somehow manage the food trucks that are out there?
I don't know if it creates more congestion. What I think it does is it gives people more options, and who doesn't want more options when it comes to you know, their meals. The thing that bothers me most is one of the concerns of the brick and mortar restaurants is that they pay property taxes and food trucks don't. So it's not fair competition because food trucks can offer lower cost food. They're not saddled with a property tax. Maybe instead of just saying food trucks can't be within 200 feet, we could come up with some kind of compromise where food trucks pay a certain tax. I know they pay a license fee, but it's not very much compared to property taxes. So maybe that'll kind of level the playing field.
Well, I'm glad you brought that up because we have some sound from people reacting to the food truck decision. Take a listen.
I don't think there's any Mexican restaurants in downtown that serve the same food as us, so I don't think there's much competition there.
I think food trucks are amazing for the city and of Chicago, but only certain people are allowed to have the privilege of even having like that kind of thing. Like not everyone has those resources. And I think that's the beauty of food trucks. Like anyone should be able to do it.
I think it's just politics. You have big restaurant owners who think that the these small little food trucks are going to take them over or really provide competition, and they're really not.
Final thoughts on this topic. What's your reaction to this decision?
Well, as you can see, the food trucks are very popular, and you know, I'm not a fan of the decision either. Coming from a legal perspective, anytime government passes a regulation, when the courts are analyzing it, they decide which level of scrutiny they're going to apply. It's either strict scrutiny, intermediate scrutiny, or rational basis. And unless you're in a protected class like a gender-based class or a racial-based class, business owners in this case would be subject to a rational basis, which means any conceivable thought will be found to uphold this regulation. And what Judge Demacopoulos found here was sidewalk congestion, you know, preventing it, which I think everyone, you know, would acknowledge is a pretty absurd idea to justify the law. But
well, it's pretty unrelated to the law itself. The law has to do with proximity to restaurants, and
Indeed.
it really is not.
Well, and then there's the
related
issue
to
of GPS tracking, which gets into personal privacy. I want to move on, though, to Democratic legislators are suing the state for their pay. They want to get paid when we're in a budget impasse. Shelby, is that fair? I mean, most of them have part-time jobs, but others say that this is their, you know, full pay. They haven't been paid in 6 months. Should they get their money?
Well, they should eventually get their money, but I don't know if they should be at the front of the line. There's other businesses, other social services that aren't getting paid. Why should the lawmakers get paid before them? You know, we've been in a budget impasse for so long. Maybe this is the thing that will nudge lawmakers to come to a compromise.
Well, and in this case, Leslie Munger, the controller, put this into place. Now Susana Mendoza won her seat. She's going in. She even agrees. So is this a little strange timing that they would sue one of their own?
Well, she agrees, sort of, right? I mean, and this is one of the things that really illustrates the frustrations of Illinois voters. So one of the entities affected by the paycheck freeze is the Attorney General's office. The Attorney General and the Attorney General's office is the entity responsible for defending Munger and Mendoza against this lawsuit. So the very person whose paycheck is frozen will be defending against the lawsuit that's brought to have her get paid. And the lawsuit is brought right before the Democrat took office. So it begs the question, how much of a defense will really be put up with respect to this lawsuit? And it does serve as a bit of a frustration when voters see these types of conflicts of interest arising when we haven't had a budget. Really critical social services are not being funded. And it's not just that. I have a friend who's a dentist who has a number of Medicaid and Medicare patients, and he's not getting paid for them. His business is losing lots of money. So he, as a business owner and as somebody who goes to work every day and does his job, isn't getting paid and has not been getting paid.
So in our last 20 seconds, do you feel sorry for the guy?
I think it's you're going to be hard pressed to find many Illinois voters who are sympathetic to this cause. I mean, you know, the average salary for the private sector worker in Illinois is $53K.
Right.
These lawmakers are making an average $77K for a part-time job.
It's true.
Which they're arguably not doing because we're still at a budget impasse, right?
Yes.
So I fully agree with the points brought up by Shelby and Charmaine, and good luck.
Well. Thank you all. Great information, very interesting topics that we discussed today. Again, thank you to our guests, John Geocaris, Charmaine Cruz, and Shelby Livingston. Thank you.
Thank you.
In this week's Art Chicago segment, we're introducing you to a sculptor, Garland Martin Taylor. His work has been described as powerful and culturally, socially, and relevant pieces of public art.
As a kid, Garland Martin Taylor used to hop the freight trains with his friends on these South Side Railroad tracks. The steel and movement around the city laid a foundation for his future direction in art.
We used to play on the railroad tracks, right? See, back then, before 9/11, we would run around, we would hop them freight trains right at 31st Street and take them all the way down to that turn and then hop off and go downtown.
Taylor and his friends would walk past the Art Institute of Chicago, and years later, Taylor would get his training from this school.
I shunned going to school because I felt like if I went to school, it was going to taint somehow what naturally was creative inside me.
After 10 years on his own, Taylor turned to professional instruction at the Art Institute. There, he developed as a sculptor. Now he was on the path to creating more than 300 works of art.
Neighbors had gathered in a city park to watch a late-night basketball game when gunfire sent them running for their lives.
Beginning in 2014, Taylor used his art to make a moving statement about gun violence in Chicago.
You read these stories, you see these people in the street, you see and hear people talking about what are we going to do about this problem. When I ask myself, what can I do? I can make an object that continues a conversation about this plight. And when I think about it, the only object to address gun violence is a gun.
100 names, all victims of gun violence, are engraved on this 400-pound sculpture. Taylor titled it Conversation Piece. Once he finished the work, Taylor loaded up the sculpture and took it on the road.
I can't wait for someone to discover that I have this work of art that addresses gun violence when so many people are dying now, and we need to be talking about it now. So I said, well, let's make this a piece of public art that we can take wherever I want. I made every place I went, every gas station, every rest stop was my own gallery, was my own museum, was my own, meeting place. No matter where I went, when people would see the gun, it was the gunness that was most striking and most arresting, and not the issue of Black Death. And I wanted it to be the other way around. The reason why I went from the 400-pound gun to a half-ounce bullet is because I wanted to scale back this initial impact.
In August, Taylor's latest work, Flight, a collection of bullet casings flying through the air, was on display at Weinberg Newton Gallery in Chicago's River North neighborhood. Each bullet contains a lock of Taylor's hair.
How do I subtly address identity? That's how you do it. And how do you address the idea of bullets flying? Well, you put feathers on them. No two projectiles are the same. Each one is completely different.
Last month, both of Taylor's pieces were moved to the Bridgeport Art Center Gallery. The artist knows gun violence won't disappear, but he hopes his work will spark dialogue about why so many in the city turn to deadly weapons.
Flight and Conversation Piece, I would consider them my masterpieces, because it is something that I make out of total creative freedom. And then it has the power to make people stop and think.
Earlier this year, the Illinois Council Against Handgun Violence collaborated with Garland Martin Taylor and Weinberg Newton Gallery. For each bullet sold, $100 was donated to a gun control group. And that concludes tonight's program. You are now in the loop. To learn more about our show, visit wycc.org and look for the link to In the Loop. Until next week, for Chris Bury, I'm Lauren Cohn. Good night, everyone.